I think that the go-getters get it wrong, no pun intended, where getting after it and being hard driving is really important. But we've all seen examples of this. I've seen a number of these in Silicon Valley, friends that did very well in tech, get to the point where they reach that finish line, and then they don't have a whole lot of people to share that with, and they end up very isolated and depressed. And then they go through this whole cycle of trying to find themselves. And you need to balance serotonin and dopamine, maybe across the day, maybe across the week. I think in religious practices, all religions really, there's a kind of Sabbath, there's a rest period, for many, or I think all of them. That makes sense because there needs to be a renewal, whether or not people have a religious practice or not. There needs to be a renewal,
a recovery
to recover the immune system. You can't drive the immune system all week. You need to recover it.
This is why I love sports analogies, because there's a preseason, there's a season, there's a postseason where you're really in high stress and emotion, and then there's a postseason. There's an off season for a reason. You can't be in season 10 years. Absolutely. So what do you do every day to get more serotonin?
So sleeping an adequate amount is key. The practice that served me the best has not been a meditative practice. There are two practices. One is called Yoga Nidra, which doesn't involve any movement. It literally means yoga sleep. This was introduced to me about 5 years ago.
Just laying on your back?
You listen to a script. There are a lot of scripts on YouTube, and it teaches you there's some breathing involved, but it's really a body scan. You learn to go into deep relaxation.
Yes.
I do this once or twice a day. If I wake up and I haven't had enough sleep, I do it first thing.
5-10 minutes?
There's a 20-minute script I like. There is a 10-minute script that's out there too. I can give you the links to these if people are interested in them. I have no affiliation with any Yoga Nidra businesses, but I love the practice because I feel like I recover the sleep I didn't get. I then feel really alert. In the afternoon, if I'm feeling tired, I'll do Yoga Nidra. It also involves some intentions, which has a kind of self-hypnosis component. And I have a colleague, David Spiegel, in the Department of Psychiatry who does clinical hypnosis. And these intentions that we do in states of deep relaxation are known to have positive effects on thinking and action. They are in pain mitigation and even breast cancer outcomes. David's work has shown that. So we're not saying stage hypnosis with like a pendant. We're talking self-hypnosis or medical hypnosis.
Well, it's like you said, deliberate thought as opposed to reactive thought.
Right. And you're teaching your body and brain to go into deep relaxation deliberately. You're doing it. And that's, I think, a power tool.
You're saying, okay, lay down, relax your body, relax your face, breathe slower. You're telling yourself to do it.
You're using the body to control the mind. That's and you're deliberately turning your thoughts off. Most people can't do that. And so for me, Yoga Nidra has been a absolute amplifier, accelerator, whatever you want to call it, on my career and life and well-being. It also gets you better at falling asleep, because one of the reasons why people have trouble falling asleep is they can't turn their thoughts off. So you're training your nervous system how to do this. I should say, because it sounds a little bit out there in the kind of new agey space, there are several studies, imaging studies, positron emission tomography studies, and others looking at Yoga Nidra specifically. This wasn't work done by my lab, although we are exploring it in my lab as a tool for stress mitigation, anxiety mitigation. But these studies show that 30 minutes, I believe it was, of Yoga Nidra resets the levels of dopamine in an area of the brain called the basal ganglia, which prepares the brain and body for action. So these deep relaxation states, even if we're wide awake still, allow the nervous system to reset so that it can get back into action. So for the go-getters, if you want to have a long career, you want to high perform your whole career, you want to have tools that allow you to reset that dopamine level, because that is accomplished, that has a huge effect, on buffering adrenaline, as we said earlier. But in addition to that, serotonin is what resets the dopamine pathway. So now there's sort of what we're seeing as kind of a logic to it. You need to alternate rest and effort. You need to reward effort. You need to understand
with rest.
So there's Yoga Nidra, and I would say the best time to do it is first thing in the morning, before you go to sleep at night, or any time of day. In other words, I believe everyone should have some deep relaxation process that's deliberate, that doesn't involve ingesting anything,
Not food or wine or
For some people, a drink is fine. I'm focused on behavioral tools. Supplements and drugs have their place, and so there are clinically depressed people that need a boost in dopamine or need a boost in serotonin. And I think, even though drugs like Prozac get a bad rap, those drugs have also saved millions of lives. There's just an appropriate dose and context, and some people shouldn't take them.